Welcome back to HealthWise. And if you're just joining us tonight, our special guest tonight is Dr. Jenn Tate Brasseaux.
Hello.
Correct. And Jen, before we get started, if you would just tell our viewers a little bit about yourself and your practice.
Well, I'm a native. I grew up in Opelousas, and I opened up an optometry practice. It's a relatively new practice down by OGH, the South Campus. We're right next door to that, and we're a family eye care, and we see patients of all ages.
Great. As most people that's watching, I said Jenn Tate Brasseaux, as in Dr. Tate. She comes from a family of doctors, and I think your sister, your older sister or younger sister.
She's an older sister.
Is also a doctor, and
another Dr. Tate.
Another Dr. Tate. So so it's excuse me. It's great that you've come from a family of doctors and want to come back and contribute to the community. Well, Doc, your specialty is family eye care. So I think first our viewers want to know how young. Since we're saying family, is it too young to, or is there any such thing as too young to get eye care?
Not really. There's not really anything such as too young now. Lots of associations are starting to recommend patients have an eye exam at 6 months old or older, but 6 months old, and there's actually a program called Infancy where you can find an infancy provider, one of your doctors in your hometown that will see your child for free from 6 months old to a year.
Wow.
There's a program that the AOA offers for that. So
how would if we wanted to be a part of that program, like for our viewers, how would they go about? Do they have to get a referral from another doctor?
No,
Okay.
you can actually just get on the internet and look up an infancy provider, and you can go to that doctor's office or call and make an appointment and let them know that you'd like to take advantage of the infancy program, and your doctor can.
So I assume you're one of those providers.
I am one of those providers.
Okay. Well, Doc, what contributes? I know you see a lot of kids wearing eyeglasses at an early age, and it just seems to me like you're seeing more and more of that. It's not when I was in school, which was a long time ago. I didn't see that many kids wearing eyeglasses, and I don't know if that's because they just didn't know any better, they needed glasses, or is it just something that's happening now?
Well, Reggie, I think that's exactly right. A child really doesn't know if blurry is blurry because they have nothing to compare it to. And patient education has gotten much better, and it's a wonderful thing that parents bring in their children at an early age, and there are more programs out there where they're doing more school screenings and they're catching early problems early on because we develop vision from about birth to age 8 or 9, and if there's a significant prescription that's not being corrected, if there's an eye turn, if there's a difference between the two eyes, those are all potential reasons for children to develop a lazy eye, and if they have one good seeing eye, they're not going to tell you that they're not seeing, and if they get those eyeglasses later on in life, they never will have that normal vision because they didn't develop it because they weren't given the opportunity with glasses.
Okay. Well, so I guess what we're saying is early prevention.
Prevention is the key.
Is the key. I know a lot of people have questions about nearsightedness. You always hear, that's the main thing you hear about, nearsightedness or farsightedness. What exactly is nearsightedness?
Nearsightedness, myopia, is when you can see up close, but your distance vision is blurry. We fix that with contact lenses or glasses. And farsightedness is the opposite problem, where you see great for distance and then you have trouble with your up-close focus.
I think we were talking about that. I think that's my problem now. And does that come, is that eye strain, eye disease, or is there a reason, or is it just age?
Well, there is another condition called presbyopia, which is that age 40 disease, where we lose that ability to focus up close, and you then need a pair of bifocals or reading glasses, and that does affect your near focus. Okay.
So, like I said, that's why I guess it's important to get to an eye doctor as soon as you can. because like I was saying, I know I didn't have a problem up until right about my, I guess, mid-40s. Then all of a sudden I woke up one morning and it was kind of funny. I thought I had a stroke because I woke up and I couldn't focus on the clock, was like right close to the bed. And I kept looking at it and I was like, oh my God, I can't see. You know, I mean, you know, and being in the medical field, first thing I thought was, oh man, I had a stroke. I was sleeping and I had a stroke, you know what I mean? Because I can't see, you know what I mean? But then I realized I could see far. So what's going on?
Right.
Well, I immediately went to the eye doctor, and they kind of laughed it off. You know, they said it's something called age. You know,
yeah, exactly.
You know, you're just getting older.
And absolutely, just because you're seeing well doesn't mean that things are well. And like you said, prevention is the key. Having a yearly eye exam is really important, because when we look inside the eye, we can see the blood vessels and we can see certain diseases that cause early changes in the retina: diabetes, high blood pressure, cholesterol issues. Any kinds of those diseases, we can actually catch it first and send you to your appropriate doctor for that kind of.
Well, that's interesting, because we were talking to some other doctors earlier, and they were saying how that, you know, they have problems with patients with diabetes and everything, and they said if they'd only go to an eye doctor, it could have been caught.
Exactly.
How exactly do you, you know, I mean, what do you look for, like in someone that has like diabetes and, you know?
We're looking for leakage of fluid from the blood vessels, bleeding in the back of the eye, new blood vessel growth, swelling of the macula. Any of those changes can indicate diabetes or blood pressure issues.
Why is it that people with diabetes seem to lose their eyesight? You know, what exactly is the mechanism? Well,
it's keeping that blood sugar controlled. You know, keeping that blood sugar 120 or below, or your A1C value 6.0 or below, is going to go a long way in preventing those blood vessels from becoming damaged and preventing their vision from being lost.
So it's basically the blood vessel damage, so it causes the loss of eyesight. Well, that's, I mean, that's just proof, like we said, you need to go to see an eye doctor.
You need to see an eye doctor.
As soon as possible. I know y'all check for pressure also. What does that do? What does that
checks for glaucoma, and there are many, many different types of glaucoma. Just because their pressure is normal doesn't mean you don't have glaucoma, which is another reason to have a dilated eye exam. So we can take a look at that optic nerve. But glaucoma also does tend to run in families. So if you have a family member that's been diagnosed with glaucoma, you need to have an eye exam as well.
Okay. Well, we'll be back shortly after a brief message from our sponsors with Dr. Jennifer Tate Brasseaux.